So what are the specialties for the cancer management? So when we look at a cancer as a disease and in terms of treatments, there are various verticals which are involved in terms of the management. Cancer treatment is typically done through medical, surgical and radiation approaches. So these are, you can say, the main tenets of any cancer management. When you talk about medical oncology, it is more about giving various medications. These medications have an ability to kill the cancer cells, and that can be done through chemotherapies, immunotherapies, targeted therapies, hormonal therapies and etc. Surgical oncology. So when you say surgical oncology, it basically involves physical removal of the tumor. Tumor means the group of cells or the lump or the mass which is formed in the body, and to remove it physically through a surgery, complex surgery with a good adequate margin, and that's the job of a surgical oncologist. So surgical oncology, medical oncology work in harmony, and we try and understand whether some patients require surgery first, some patients require chemotherapy first, but not to forget the another important branch, which is the radiation oncology. Radiation is nothing but it involves high energy of X-rays. Imagine a high beam of energy which is hitting the tumor, and that leads to the damage of the DNA, and that leads to the killing of the cells, and that is how the radiation works for our patients. So all these branches, they work in kind of a synergy so as to give the best possible outcomes for the patient. So how they should be all be utilized, it all depends upon a good multidisciplinary team which involves discussion amongst the medical, surgical as well as radiation, and so as to possibly get the best possible plan for the patient in terms of its cancer management. So these are some of the important areas or important aspects for treating a cancer patient when you talk about various branches for oncology management. Thank you.